Welcome back to NMP Talk Show, the show that keeps you informed and engaged with topics about your mental health, wellness. And today we're talking about diabetes mellitus. What a big word there. Sweet sacrifices, navigating life with sugar diabetes. And with me in the studio for the first time on NMP Talk Show, we have a guest in studio. And our guest today is Dr. Itesa. Dr. Itesa, how are you doing? Welcome to our studio.
Thank you very much for having me, Neil. I'm fine, thank you, and I hope you're fine as well.
Oh, yes. I'm excited. I've been waiting for this day, and it finally came, and we're happy that you are able to come through to the studio. Now, as I've mentioned, we're talking diabetes today, and we want to engage with you, our precious audience who are connecting on Telegram and also on Riverside. And if you, by any chance, on YouTube, you also catch the live streaming of this session. But then later on, we'll send you a recording of it. So while we getting our guests right for the show, what is diabetes? And a lot of people are being diagnosed about diabetes, and not knowing how to deal with it can be something that we cannot deal with. So having a professional to explain that for us will help allay the fears that we might have about diabetes and how we can care ourselves on a day-to-day. So we want Dr. Reis Itesa to help us with that. But before he does, who is Dr. Reis Itesa?
Yeah, you said the name. The name is Reis Itesa. Another name is Manunga. I'm a medical practitioner. And for now, I've been practicing for many years, for more than 10 years in the field. And for now, I'm busy in the private sector on a medical private practice.
Oh, nice. So the credential says a lot about Dr. Reis Itesa here. So, as I said, he's the man to tell us what is diabetes. What is diabetes, doctor?
Yeah, that's a good question to start with because we need to know what are we talking about. Diabetes has been mentioned first time many years ago, centuries, since the 3rd centuries before Christ, BCE. And the first one to come up with the word diabetes mellitus is a Greek physician, Demetrius, and also another one, a Latin one, Apollonius. So the word diabetes mellitus means siphon or pass through, and mellitus means sweet. So in essence, diabetes is actually sweet or sugar passing through your urine. Hence, at some point, they mentioned the word honey urine because someone has to test the urine from a diabetic patient and feel that it was sweet. So then that's the etymology of the word diabetes.
Okay, before you go further, somebody has to taste or had to taste.
Had to taste so that they actually diagnose that you've got sugar diabetes.
Oh, okay.
Back in the days.
We're talking back in the days. So, I can't imagine doctors doing this now in this day and age.
Now today, diabetes is defined as a chronic condition which is characterized by an increase of level of sugar in your blood. And talking about level of sugar which is beyond the normal range, now we need to know what are the normal range. The normal range, if it depends if you are fasting or if you haven't eaten anything for like a couple of hours, up to 8 hours, then they can test your blood. If the values comes more than 7 millimole per liter, you are diagnosed with diabetes if you haven't eaten anything. But if you ate something, then for you to be diagnosed with diabetes, your sugar level is supposed to be 11.1, more than 11.1 or equal to 11.1. Then you've been diagnosed and you need to be taken care of.
Because I could not understand it before, the diagnosis, how they get to know if you're diabetic or not. With the sense that, with my small knowledge of everything in this planet Earth, how do you rate or see the level of sugar that's passing through the blood, and then you could say, this person is diabetic, and somebody doesn't feel like, I must say, I was diagnosed with diabetes, and but I didn't feel anything. I don't even feel anything even now. But the signs which are there that the doctors are seeing and which I'm treated for, only then I know that I'm diabetic. But I feel better. I feel healthy. So, no, thanks for that explanation about diabetes. And maybe another question, is it worthy to discuss about diabetes?
Yeah, I would say yes, it is worthy. Diabetes is a rising concern in nowadays. Why? In South Africa alone, the prevalence of diabetes has increased so rapidly from 4.5% in 2008 to 12.7% in 2019. So it shows how much from 4.5 to 12.7. It's really a big concern. And in 2003, it is estimated that around 4.5 millions of South Africans are living with diabetes. 4.5 millions.
That's a lot of people.
And with an additional of 1 million which are undiagnosed. They are roaming over the street. They don't know that they've got diabetes. So this tells you that really diabetes is a concern. And according to the WHO, the World Health Organization, more than 500 million of people, to be exact, it's 529 million are living with diabetes worldwide. And in 30 years from now, it's projected to 1.3 billions if efforts are not made to try and improve the conditions of our lives.
Yeah. Those are staggering numbers. I mean, they're very scary. That you even mentioning that you have over 1 million people walking about and they don't know if they're diabetic.
That's
very
true.
Scary.
It is.
Sure. So if you connected on Telegram, you can raise your hand there and you ask a question to our doctor here. Or if you want to comment or share an experience, you can do so. Maybe you want to relate an experience that might need some explanation from the doctor to help you out. Please feel free to do so. We also have audience that are connecting on Riverside, the platform that we're streaming from. You can use a chat function there to send your question or comments, and then Dr. Reis will be able to answer them. So let's move on, Doctor. We've explained what diabetes is. We've explained the need to discuss this topic, this illness about diabetes. Another question, how many types of diabetes do we have?
Yeah, we need to know what are we dealing with. We've got mainly two types of diabetes. It's type 1 and type 2. And we've got subtypes or other smaller types. So type 1, it's defined as a chronic condition in which the pancreas, which is one of the internal organ in your digestive system, produce little or no insulin. So it typically appears to adolescents, teenagers, and about 5 to 10% of people are developing diabetes type 1.
Sure. So type 1 and type 2. So which one develops because of lifestyle?
Okay, let's go for type 2 first.
Yeah.
Type 2, it does affect anyone as you said, who trying not to really stick to a good lifestyle.
Those burgers.
Yeah, so here it does affect the way your body uses the sugar or the glucose, which is a major source of your energy.
Mm-hmm.
And here the insulin is produced by pancreas, but is not properly used, and which leads to high level of blood sugar if not treated. And about 80 to 90% of people are developing diabetes type 2. And there is another type, which is gestational diabetes, and this is happening to pregnant women.
Okay.
Yes, to pregnant women, and they do develop diabetes later in their pregnancy. And again, the other one, the last one that I would like us to mention here is pre-diabetes. It's like a stage before you get into diabetes. So you still have high blood sugar, but not high enough to be called diabetes type 2.
That's your pre-diabetic.
Pre-diabetes. So, like you said that you've been diagnosed with diabetes not long ago. It means you've been having pre-diabetes for quite some years. Can reach up to 10 years without you knowing.
Sure.
Yes. So, and then up until you reach some high level of sugar, when tested, then you can be diagnosed with diabetes.
So can you reset your body? You know, if you're pre-diabetic, can you reverse it?
Yes, you can. Lifestyle come into play here. So you need really to make sure that your lifestyle is healthy. You're having a healthy lifestyle. I mean, you're avoiding sugary beverages. You're avoiding. You're exercising, and you're trying to have a good night's rest. Because when you're resting, your body's functioning properly as well, instead of you being in action at all time. So those are a few things. Your diet, you go for fruits and vegetables, and you try to avoid what is sugar, and also you try to exercise as well.
But if you exercise, are you not burning that sugar?
Of course, you're burning that sugar so that it can go to the muscles who need it.
Oh, okay. There'll be excess sugar that goes in
the muscles. So there won't be excess sugar that's going to stuck in the bloodstream. So sugar is there. It needs to be used. And when you're exercising, your muscles are in need of sugar.
Okay.
And the sugar goes into the muscles.
Is the expression "sugar gives you energy" more appropriate in that?
Of course, the sugar gives you energy to push in your exercise, physical exercise. Actually, in everything we do, sugar is like fuel.
Yeah.
Without fuel, a car cannot move.
Yeah.
Without sugar, you don't have any energy, any strength. You cannot even open your eyes if you don't have sugar at all.
You know, I know you touched on this while you're explaining about this, but I just need you to elaborate more on it. The process that the body goes through to a point where it develops this condition of diabetes. It could be type 2, for instance, that comes with lifestyle and all of that.
Yeah, good question, Neo. Can I please ask you to show off the figure one?
Yeah.
So that our audience can understand what are we talking to.
Yeah.
Okay. So as you can see on the screen, the food that we eat is broken down into blood sugar.
Okay.
And it enters in your bloodstream. Then you've got a lot of sugar in your bloodstream. Now, what happened? The brain gets a signal. And it's the signal that there is a lot of sugar in your bloodstream. So now it orders the pancreas to release a certain hormone called insulin.
Okay.
Now, what is the role of insulin?
Okay.
Insulin comes into the bloodstream from the pancreas so that it can go and open the receptors of the cells and allow now the sugar to enter. I'll give an example. There's a factory that is manufacturing keys. You need that key to go and open your house so that you can get inside the house. Without that key, you're still going to be on the street. So now that you got that key from the factory, you go and you open your house and you get inside your house. The key is insulin. The house is the cell. The factory is the pancreas.
Okay. So the factory produces insulin. The pancreas produces insulin.
Which is the factory, you are right.
Yeah. And then insulin opens the door of the cell.
Of the cells, so that you can get in.
Okay.
And when you get inside your house, now you bring the house alive. Without anyone inside the house is considered as dead. So now when you get inside your house, you bring life to the house. When the sugar gets inside the cells, it brings energy to the cells. And you can use that sugar, that energy for anything you want to do.
Very interesting. This is very technical, but very understandable, for laymen like myself. If you do have any questions, please don't hesitate to ask the question or comment on what the doctor has just mentioned there by raising your hand there on Telegram and also typing your questions or comments on Riverside chat function. Now, as we propel now, Doc.
Before we get to that, I would like just to add, now that we understood the normal process, the healthy process of the factory manufacturing insulin so that it can open doors, so that sugar can get inside the cells. So now, in type 1, the factory doesn't manufacture insulin anymore. So the cells that manufacture insulin are almost dead. We call them beta cells. They're almost dead, and this is due to a human response. So your own body is fighting itself. It's fighting the cells that manufacture insulin, and you don't have insulin. That diabetes type 1. So meaning you've got sugar at your doorstep, but it cannot get inside the cells.
So it's piling up.
It's piling up. You're piling up in the bloodstream. And when they check your blood, they find you've got a lot of sugar and you're diagnosed with diabetes. So meaning you cannot even get inside your house. You don't have a key. There's no insulin. You're stuck outside. So now, what happened in diabetes type 2? In diabetes type 2, there is less insulin that has been manufactured. But now there is a resistance. Insulin encounter resistance to enter inside the cell. So you've been given a key, but the key cannot open the door so that you get inside your house. You're still stuck on the street. Sugar stuck in the blood. When they check, they find that you've got high level of blood sugar.
Doc, while you're there, I see there's a question on Riverside. It's from Tressa. Tressa, welcome to the show. Tressa is sending this message from the USA in New York. She says, what is the best way to lower the blood sugar of type 2 diabetes and keep it in a normal range?
That's a good question, Tressa. Thank you very much for asking that question. The good way to lower your diabetes, your sugar level, especially in type 2, is actually physical exercise.
Okay.
That is the best way, because when you exercising, you increasing demand of your cells to use the sugar that is stuck on the bloodstream to enter inside the cells. And exercise makes your insulin sensitive to enter inside the cells.
Okay.
Yes.
So
it has been
basically
forced to enter.
Like the wall of the cell becomes, let's say, softer?
Permeable. to enter.
That's the right word. Hey, can we exchange the the names there? All right, Trasa, I hope your answer has been your question has been answered there. Exercise is the key, and a lot of people, we don't exercise. I mean, I look at the amount of cars that are on the road. There's so many cars, especially when you have to drive through peak hour. Where do you get time to exercise? We're so lazy now. If I have to go to a tuck shop or a spaza shop, I don't want to walk. You know, like it's hot. I'm lazy. I drive to the shop there and quickly buy whatever I need. And what other foods that one can avoid? Talking about buying food, being lazy to walk and exercise. Is there some type of food that actually we must, stay away from?
Yeah, we need to stay away. All of us, we need to stay away from food that has high sugar level. Your soft drinks.
Mm-hmm.
Yeah, that's the one that we need to really avoid. Your takeaway, your fast food. They are not healthy.
I mean, when you paid,
Unfortunately, we need to avoid those type of food because they're rapidly being processed into sugar in the blood, and you've got high level of sugar. Unlike your fruit and your vegetables, they take time to be processed. So you don't have high amount of sugar in a very short space of time.
Oh, okay. So it breaks evenly.
Yes, evenly, steadily.
Okay. Very interesting. Yo, thanks for coming to the show. We do have the internet that can explain this, but if you have to read it on your own, sometimes it doesn't make sense until somebody sits down and explain it to you. And we really appreciate that, Dr. Itesa, for that. So I guess to this point, we can rightfully say or confidently say that diabetes can be treated.
Yeah, diabetes can be treated because, it depends on which type of diabetes you have.
Yeah.
Type 1, we said that there is no sugar produced by your pancreas. I mean, there's no insulin produced by your pancreas. So then the treatment will be bringing insulin into play. It's just going to work as if your pancreas was working properly, producing insulin so that it can allow the cells to take in sugar, glucose.
Right.
So that is treatment for diabetes type 1. For diabetes type 2, I'm not going to mention products or medicine here. I'm not prescribing anyone.
Yeah.
But there are pills. There are pills that can help you actually to make insulin become sensitive to the cells so that it can allow the sugar to get into the cells and actually decrease the blood sugar level into the blood. So those are the what we call drug treatment.
Yeah.
And there is also non-drug treatment, as we earlier mentioned, your physical exercise and your healthy diet. Yeah, those are things that we really need to keep in mind.
Sure. I need somebody to accompany me for exercising. Yeah. This is like a taboo, just to get up in the morning and exercise or whichever time that's convenient. But you need somebody to motivate you. But I've got motivation enough from this topic that we're having. So I wonder if you do still have questions on Riverside and also on Telegram. You're more than welcome to do so. So by the way, we're streaming also to YouTube, and you can also get this recording of this show after it has been edited in a day or two, and it will be on other podcast platforms as well. You can have audio from that podcast. Now, let's get into the sweet sacrifice. You said diabetes mellitus.
Mellitus.
Mellitus, which is something has to do with something sweet. Eh?
Sweet, as in true.
So let's get into the sweet sacrifice part. What can one do in order to avoid or prevent it?
Yeah, as you said, sweet sacrifices. We need to sacrifice sweet.
I didn't get it before.
Plainly said, we need to sacrifice sweet. So whenever you pass to that sweet shop or to that takeaway shop, try and withhold yourself so that you not get tempted, especially if you've been diagnosed already. If you were not being diagnosed, use it in a moderate way.
Yeah, you know these shops, these marketers are very, very intelligent. I mean, when you walk in the aisle to pay for the goods, that's all you showered with, the whole aisle, you know, of every type of sweets, and it can be very challenging not to be tempted. You know,
tempted.
Yeah, but I get you. It's all also about moderation, I guess.
Very true. Moderation.
So, are you saying if you diagnosed, totally avoid sweet stuff?
Use it moderately.
Okay.
Yeah, use it moderately.
That gives you confidence.
But again, if ever your blood sugar goes very high, you need discipline. Yeah. You need to try very hard. So don't not easy, but try and limit your sugar intake.
We do have a question on Telegram. Paulina, I'll unmute you. You can unmute yourself and shoot.
Hi, thank you.
Sorry,
I just have a question, especially around the eating sugar stuff, right?
Paulina.
So about then other things.
Paulina, sorry, it's just a moment.
Okay.
The doctor was wearing the headphones. You can start again.
Okay. No, I just wanted to ask the questions, especially around the, sugary sweet stuff. So what about fruits? Because fruits are natural things, So I wanted to understand, can, the sugar from fruits affect you? And what would be advisable in terms of the amount of, fruit one can eat on a day? I know our blood sugar levels get spiked by different things, and even the numbers that, like, for example, when I compare how much fruit spikes me in comparison to my husband, who's also a diabetic, it's different. But just to understand whether, should one stop completely eating fruits, or moderation is the key?
Thank you, Paulina.
Thanks, Paulina, for that.
That's a good question, a very pertinent question. We all need to know, sugar, there is bad sugar and there is good sugar. The bad sugar is what we are trying to emphasize here. We need to limit. And if your blood sugar is very high, we need to avoid, because it's only going to raise the blood sugar level. So now, when it comes to your question about fruit, because you say that we need to know, because fruit also has sugar in it. Yes, you are very right. You are very right. Fruit has sugar in it. There are fruits on its own, it's good, because even if it has high sugar level, but it's steadily processed, evenly processed, takes time to reflect in your bloodstream. So it takes time. It's not that bad sugar that you drink from the soft drinks. Processed sugar, which takes a few seconds and just explodes your blood sugar level. But the sugar from the fruits takes long to be processed. But we also need to know there are fruits that are high glycemic index fruits. Those ones have got high level of sugar. So we also need to try to avoid. We can eat them, but with moderation. Others will be good. I'm not a dietitian. I'm not one to take a place of a dietitian to tell you which fruit. Like your banana has a high level of sugar.
Pineapple?
Also, yes.
Watermelon?
All those fruits, when you eat, you really feel that it tastes...
The sweetness.
The sweetness.
Okay.
those are the fruits to have with moderation. Yes, to have in moderation.
And those fruits that I mentioned to you are my favorite. And yeah, it was a sacrifice, to limit them. I was gifted a watermelon. Unfortunately, I can't eat it.
You can eat it with moderation.
Oh, with moderation, okay.
So, Paulina, to add on your question, it's better if you want to have a detailed list of what to eat and not to eat, then comes a dietitian. Yes, you see, a diabetic, it's a chronic disease that needs a multidisciplinary medical professional to handle. So the doctor will diagnose, will set up a treatment. Your diet will be, you have a eating plan diet through a dietitian. So I'll advise you to contact, to consult with a registered dietitian who's going to really assist you as to know, have a proper list, an exhaustive list of what you need to eat and what you need to avoid.
Yeah. Paulina, are you answered? Is your question answered?
Yeah, yes, I am. Thank you.
It's a pleasure. All right. Teresa is back again. She says, thank you for mentioning the fruit sugar because the doctors have told my family to avoid fruits, but it's good to know that you can eat fruits, but to eat in moderation. Yes, Teresa. Moderation is the key.
In moderation, especially if your sugar level is controlled.
Yeah.
You can use it in moderation. If it's very high, then you really try to avoid those high glycemic index fruits, those who have a lot of sweetness.
Sure. Now, let's come to complications. What are the complications that we might encounter as somebody who's diabetic?
Yeah, complication is a major issue with diabetes. When you're saying people are dying with diabetes, it actually means they are dying more with complications than with diabetes on its own. So why do we have complication in diabetes? Because diabetes induces high level of sugar in your blood, and that affects your vessels. It affects your nerves. And diabetes, because of high level of sugar, especially diabetes type 2, it makes you gain weight.
Okay.
And when you gain weight, you're exposed as well to so many conditions, like your heart attack,
cholesterol,
your heart disease, cholesterol, as you said, and your blood vessels been damaged, so you might have kidney problem as well. So you might not feel your leg, hence you might have a cut and not feel the cut, and that cut's going to be infected. And then before you know it, you've got an infection that is going very fast up to your leg. That's going to lead to amputation.
Oh, wow.
And another complication could be also your blood vessels in the eye are also affected, and it leads to can lead to blindness, can lead to retinopathy, it can lead to cataract. So those are the things to really keep in mind.
Hey, why are we still alive, eh? I wonder. It's just a miracle that we're still alive, some of us. All right. Dr. Reis, in African culture, people use muti or, a herbal medicine. And you also have companies that are selling plant-based medicine that would say, if you take these, it could help you with your diabetes and, other illness. What is your take on that?
That's a good question, especially in African culture. We live in Africa, so we really need to mention this. We're not saying no to the African culture. We embrace the African culture, and traditional medicine actually does a lot in terms of well-being of our patient. But there is something that need to be clarified here. When you have that cocktail made by your traditional healer or by your granny who claim to heal or prevent diabetes, we don't really know the exact amount of the active ingredient that are in that cocktail.
Okay.
Because with the modern medicine, we know that in metformin, for instance, we've got 500 milligram of metformin. We've got 850 milligram of metformin. So we know when we test your blood sugar, we see the level and we can tailor-made that level of blood sugar with the medicine that we've got at hand.
Okay. So
But
it's
then,
not like a thumbs up diagnosis.
No, it's not. It's precise
Yeah.
and it's well targeted. Unlike the traditional medicine, which is good, but we would like really to emphasize, we don't know how much active ingredient is in that cocktail made to help you deal with your condition. Hence, it might cause more damage than good, because whatever you eat, whatever you drink, get processed by your liver and by your kidney. So if the active ingredient is higher than normal, the concentration is higher than normal, it might affect your liver or it might affect your kidney. So we really need to know how much concentration in milligram or in gram that one need to take.
So there's a lot of factors to take into consideration when you're doing that cocktail.
Yeah, when you're doing the cocktail, you need to know.
Yeah.
You need to come up with numbers of the concentration of the active ingredient.
Yeah.
And that needs a long process in the laboratory. And that process, that's what we rely on with modern medicine.
Yeah.
Medicine has been processed. It has been checked. It has been trialed. It needs to be approved and then thrown into the market for people to consume.
Interesting. All right, let's go to Mother's Day with babies. So if a mother is diabetic, right, and they give birth, and it's said that sometimes the babies become big. How is that so? How do you prevent that? Is the becoming big a problem, or it's just not normal because of the condition?
Do you have a picture of a pregnant woman?
No, we don't have.
Okay, maybe I forgot to. Okay, when you are pregnant, many things change in a woman body. So you've got a placenta that starts forming, and the baby comes in, and the baby is nourished through the placenta from the mother. So now the mother, during pregnancy, the placenta release some hormones to sustain the baby, to sustain the pregnancy. Those hormones now are conflicting with insulin. Yes, they are causing insulin resistance to the point that when the mother eats any sugary beverage or food,
like the cravings they will have
when they eat it, then they've got so much sugar in the blood, the insulin cannot help for that sugar to be processed inside the cells because of the hormones that the placenta was releasing. Then they end up being diagnosed with diabetes, of which we call here gestational diabetes. Gestational meaning pregnancy. So diabetes that you encounter during pregnancy. More often, you'll be diagnosed in your second trimester of pregnancy.
You're mentioning, you said it gestational diabetes.
And because of that, now you've got so much level of sugar in your body, you pass it through to your baby. The baby finds himself with so much sugar and keep on gaining weight, because that's what sugar does to you. You keep gaining weight and you end up having a big baby, of which you're really going to struggle to have a normal, vaginal normal delivery. So you're going to need a C-section, a cesarean section, so that they can take out the baby, because it's really a huge baby, more than 4 kilos. You can even have a 5 kilo baby kilograms, even more than that.
Yo, this is serious, eh?
Yeah, it is. So we really advise to pregnant women to always go to a medical checkup in your clinic or to your private doctor or to the hospital, and they'll be checking your blood sugar, being following up. If they notice something wrong with it, or maybe it's higher than normal, then they will address it. Also, try not to gain too much weight during pregnancy, and try to exercise so that you can process the sugar that are stuck in
I was
your
about
blood.
to ask, try not to gain weight during pregnancy. How do you do that?
It's a difficult one because being pregnant makes you gain weight.
Yeah.
You're not alone. You've got an unborn baby inside.
Yeah.
So you naturally gain weight.
Yeah.
Every week.
Yeah.
About 500 gram you gain because of pregnancy. In a month, about 2 kilos. So which makes you, at the end of your pregnancy, you might find yourself with more than 10 kilos that you never had before. So then the point we're trying to convey here is that don't gain extra weight apart from the weight that your pregnancy is bringing to your body. Yeah, so really try to make sure what are you eating, healthy diet, and try to exercise so that you can process those sugar inside your bloodstream.
You know, we've never been in that situation where pregnancy and cravings are involved in the picture. But I'm just trying to think on behalf of parents out there who are through that process. How would they now control the cravings? Because I believe when the cravings are out there, it's unstoppable.
Yeah, it's not easy to control cravings because pregnancy equals cravings.
Yeah.
But here, discipline is needed.
Yeah.
Discipline is needed. Your health matters. And remember, not only your own health, but your baby's health also is important. So you think about yourself, you think about the baby that you're carrying in as well. So try and really keep a healthy diet, keep exercising. Don't be too lazy during pregnancy because then you're going to gain weight. And when you gain weight, fat actually, overweight causes insulin to become resistant. It's also another problem that you're going to deal with. So exercising will help you to lose some weight or to manage your weight.
So it regulates that.
It does.
Right. So if you just join us, we're talking about diabetes, how you can live with diabetes, even preventing it, especially when you're diagnosed with type 2 diabetes, where mainly comes from, your lifestyle, how you eat, the takeaways and all of these sweet stuff. And Dr. Reis here has really put it down on the table to say, avoid those things like a plague. If you are to eat them, eat them in moderation. And thank you for that. Now, here's another question from our audience there. It says, diabetic men are complaining about challenges in their marriage when it comes to their intimacy. How true is this?
Yeah, that's a good question because if you're not careful, many marriages are going to be broken. Yeah, people are going to divorce because of diabetes. So, which means we really need to manage this properly. And actually, it's not only men, it's also women, by the way. But yes, it's more men than women. So what happened in this case, when you've got high level of sugar, as we mentioned earlier, your sugar goes to affect your nerves and your blood vessels. And for a man to have a sexual intercourse, he needs to have a proper erection. And that involves your blood vessels. But now, in case of diabetes, blood vessels are damaged. So there's no proper blood flow to the male organ to sustain a proper sexual intercourse, and they will struggle. So it's really, we appeal here to our fellow men to really consult to their doctors so that they can get help, and really they will get help and they're going to be okay. And we sympathize with them as well, especially to those who find themselves in this kind of situation. And this is a complication that happen later in diabetes. That's not like everyone who have diabetes is gonna have it, but later on, if your diabetes is not properly managed, if your sugar level is not properly managed, then you can reach to that level. Yes.
So now the market sells boosters, pills. So would that help somebody who's diabetic to that level?
Your doctor will make sure first to manage your sugar level, to keep it in a normal range. If you got a normal range of sugar level, you won't really have to go through so much complication with diabetes. You'll be okay. You will enjoy your life as normal people do. But then when it's not managed well, that's when it brings in complications. So that point number one, the doctor will manage your blood sugar level with medication. Number two, your doctor is going to advise you to exercise. Exercise also will help even in your intimate life as well. So regular exercise is very important. And again, if it really doesn't help, then the doctor might think of what you call sex boosters. Then it's going to help you to sustain a proper erection so that you can have a normal sexual intercourse.
Okay. Okay, let's change gears to a lighter mode. I think we've been running with fourth gear here, and you can feel the engine is getting a strain. Let's go to gear number 5. And gear number 5 takes us back to the foods that we eat, especially the drinks. Now, if you go to shops, you have your soft drinks that are labeled no sugar or sugar-free. You have Coke Zero, for instance. Can one consume that when they're in the condition?
Okay, I'm not here to badmouth people, so I'm not going to say Coke Zero or anything.
Okay. All right. It's not sponsoring that, by the way.
Yeah, let's not mention names, but no sugar soft drinks are a concern. Yes, back in the days, we used to think that it's good because they are made with artificial sweetness. So we used to think that it doesn't carry much glycemic load, so it doesn't have much calorie to actually interfere with your blood sugar level. But then over time, it does have effect. So your doctor was not wrong to tell you use sweeteners instead of sugar. That's what we know, that's what we used to know. But recently there was a study I'd like to mention, to share here, a study in India. In India, there was a tertiary care hospital where they ran this study. They compare patients who's been diagnosed with diabetes type 2. They expose them to artificial sweeteners. And those who doesn't have diabetes, they also expose them to artificial sweetness. So when they check them later on, they found that those with diabetes type 2 started to have insulin resistance. So meaning the insulin couldn't work properly anymore to them.
So this is the consumption over time.
Over time.
Okay.
So there is a link with artificial sweetness with a insulin resistance to a diabetic patient. And bear in mind, we're fighting that insulin resistance already to the patient. Now, when you bring in the artificial sweetness into play, now you make the fight even more difficult to go through.
Okay, we'll stick to water there, hey? Will do. Right, Vincent has sent a question there. what is the difference between type 1 and type 2 diabetes? We've mentioned it before, but maybe you can elaborate for those that just recently joined.
Vincent, thank you very much for that question. We will just repeat ourselves again. Diabetes type 1 is when your pancreas, which is a factory that's manufacture insulin, cannot do it anymore. And this is due to the fact that your body is fighting its own. So it's a human response. It's a human response. So we don't have details clearly as to what really happened, but it happens that your body doesn't produce insulin anymore. So it means that your sugar will stuck in the blood and is not going to get inside the cells, because insulin is that hormone that helps to take the sugar from the blood, put it inside the cells. That is type 1. Type 2, you've got insulin but not enough. That's one. And again, that insulin encounter resistance to get inside the cells. So sugar still happen to stuck in your bloodstream and cannot get inside the cells. And when they check your sugar level with a sugar test, they found that you've got high level of blood sugar. I hope it answers your question, Vincent.
Yeah. No, thank you, Vincent, for that question. I mean, it sounds easier, but it's not easy, to explain it. I think it takes some few years to get to understand this concept. I would say just concept because, how you explained it, especially with examples of a factory, the key, it makes it more understandable to know.
Let's explain it to Vincent with that example again.
Yeah.
The factory manufactures keys. The key will help you to open your house so that you can get inside your house. So with diabetes type 1, the factory cannot manufacture keys anymore. So you cannot get inside your house. You're stuck on the street. The sugar stuck on the bloodstream, so in high level. With diabetes type 2, the factory manufactures the key. You come in front of your door, you try to open the door doesn't open. The key has resistance. The door doesn't open, so you cannot get inside the house. So insulin's there in diabetes type 2,
But it's not enough.
But it's not enough, or even if it's there, but it encounters resistance. It cannot open the door to the cells to allow sugar to get in.
That's the easier way to explain it. Vincent, if you're happy with the answer, please type there if you are. But if you're not, we can further elaborate that. But thank you so much for explaining all of these, giving us this information about diabetes. It's been a topic that's been on my mind for quite some time, but not knowing how to tackle it, to bring it to our audience, to have a better understanding of it. And especially when you're dealing with it, you're also trying to come into terms on how to choose food, getting a dietitian to prescribe a good diet for you. You're trying this and that, it's not working. And until it's normalized, what works. So it's been a journey, and thank you for taking us through the journey this hour of our show. If you have any comments, questions, please, you're more than welcome to do so. You can type on Riverside. You can also raise your hand on Telegram platform that we have. But now we seem to be running out of time as usual. This thing, it always happens. And when we hear this music, we know that our time is very limited. So in few minutes that we left, can we recap what is diabetes, how to prevent it, and how to live with it?
Diabetes is when your body cannot process your sugar in a right way, in a proper way.
Yeah.
So either there is no insulin to help to process the sugar into the cells, or there is insulin, but it encounters resistance. So that type 1 and type 2 all together.
Yeah.
And now, pregnant women will develop it because of the hormones that they have during pregnancy from the placenta, and that will cause insulin resistance as well. So, in few words, how to live with diabetes, medication comes second. First is physical exercise, and it goes along with your healthy diet. These are key with managing diabetes. It costs less, and it doesn't bring you any side effect. So physical exercise, and all we ask patients is to have 15 to 30 minutes time of exercising. We don't want you to lift weight. We only want you to walk or jog around for 15 to 30 minutes every day for 5 days. We give you the weekend to rest. That is enough exercise we ask you to do. And couple with your healthy diet. Yes, you can, Neo. You can do that. And couple with your healthy diet, really you're going to do well. And for those who are obese, we ask them to just try to lose weight. 7 to 10 kilos of your weight, if you are obese, will put you in a good position to handle diabetes. Yes, so those are a few things. Then medicine will come later on. The doctor will try to find a suitable treatment for you, so that you can manage your diabetes.
All right. Thank you so much, Dr. Reis Itesa. We really enjoyed the show today. It was eye-opening, and we've seen how we can deal with diabetes. We've seen how we can resist temptations, coming to sweet stuff. But if we do ever feel tempted to do, it has to be in moderation. Am I right?
Yes, you're
okay,
right.
All right. No, it's not like a total no-no.
if your blood sugar is uncontrolled, it's a total
it's a total no-no. Okay, so get your sugar first controlled, and then you can go back to those sweets, but in moderation. All right, I'm not prescribing anything. I'm not a professional doctor. He's a professional doctor, and his word is the last word to be said on this matter. But we really thank you so much for that, and thank you for everyone who is connected today, joining our show from Riverside, and also on Telegram, and also on YouTube. So if you know anyone that would be benefited by this information that we just discussed today, we're going to have a recording posted on YouTube and all other podcast platforms that we have. So if you're on podcast, you can listen while you're driving, while you're jogging. You can listen to the show and get informed even more. So we want to also say thank you for joining, and we hope to see you on our next show next week on Monday, same time, same place. So thank you for joining us, and my name is Morapedi, the host of NMP Talk Show, and this is how we're signing out.
Yeah.